Hello, I'm Dr. Lipi and welcome to my show, Health, Humor, and Harmony. Today's episode is the third of my series, Dr. Roy on the Road, where I talk to regular folks on the street about a health topic. Today's show is about questions you'd want to ask a doctor. Is there something you've been yearning to ask that person with a stethoscope and a white coat? Well, to investigate this topic, I went to Washington Square Park in Manhattan and asked New Yorkers, what is one question you would want to ask a doctor? Let's see how it went. Hi, I'm Dr. Lipi. What is one question you would want to ask a doctor?
What do you think the most challenging aspect of med school is?
What is the most challenging aspect of medical school? Good question. Hi, I'm Dr. Roy. What's one question you would want to ask a doctor?
It might be like a double-edged sword because I think the illnesses are related, but I suffer from eczema and asthma. So are there any foods that I could eat to alleviate symptoms at least?
So the question you would ask is, are there any foods that you can eat that can reduce your symptoms for eczema and asthma?
Yeah.
That is a great question. I will come back and answer that. What's one question you would want to ask a doctor?
So I have a huge surgery coming up, and I need to make sure I have the best healing process. So what do you think what would you recommend, like with foods and like body to get a good healing process?
So if I understand correctly, what you're asking is, what would be the best post-op regimen
And before.
a pre and post-op regimen for the healing process?
For sure.
Great question. These are great questions. So my name is Dr. Lipi, and I want to know what's one question you would want to ask a doctor.
Dr. Roy, I would like to know from your point of view, how much of medicine is science and how much of medicine is art?
What a fantastic question. Debbie is asking how much of medicine is actual science and how much of it is an art. That is a fantastic question. And it is a lifelong question, a question of the ages. As always, I am so grateful to the kind New Yorkers who took time and effort to share their thoughts with me. They asked some great questions. Now, as promised, here are my responses. The first question was about the most challenging aspect of medical school. In my experience, the hardest part of med school was information overload. Learning and retaining the vast amount of information of medical facts that are thrown your way like a fire hose. The first 2 years were a major vocabulary lesson. Osteosarcoma, pheochromocytoma, subacute, cutaneous, lupus erythematosus. And those are just the diseases. Then there's the long list of medications. We had to know the names, clinical indications, mechanisms of action, side effects. Another challenge was the sense of imposter syndrome, that you're not good enough, you're not smart enough, not efficient enough. I thought I was the only one, but of course I wasn't. Here are some challenges that a few other doctors shared with me. You can never study enough, and then you feel guilty for having fun. Being first generation, poor, not having money or a car, I felt like an outsider. Navigating the assumptions and biases as a Black male. And from Dr. Angela McCormick, an emergency medicine doctor, wife and mother of 4, and one of my dearest friends. Stressors of my personal life. Moving, planning a wedding, losing a baby. So yes, medical school and all the surrounding life factors can be very challenging. I was also asked about the ideal preparation before and after surgery to optimize recovery. My response: be sure to ask questions such as, what are the complications of this surgery? How long will I be hospitalized? How much pain will I be in? And can you explain my pain treatment plan? You should also attend pre-op screening and testing and all other appointments scheduled by your surgery team. Always follow their recommendations. After your operation, you'll likely be transported to the post-anesthesia care unit or PACU, where you'll be monitored closely by the clinical team. You'll likely be given specific instructions such as avoiding heavy lifting and avoiding driving if you're taking sedating medications like opioids. You may also want to ask your surgical team about items that may enhance your recovery at home, such as a walker and a handheld shower head. Another question was about foods that can reduce symptoms related to asthma and eczema. While there's no recommended diet for either condition, certain foods can act as triggers. For eczema, dairy, eggs, tomatoes, spices, and gluten can cause a flare-up. Asthma symptoms can be triggered by sulfites, which are used as preservatives in wine, dried fruits, pickles, and fresh and frozen shrimp. Please remember that these are general recommendations. Please talk to your doctor about your specific clinical situation. Lastly, Debbie asked how much of medicine is science versus an art. On this age-old topic, I often think of Dr. William Osler, the father of modern medicine and a fellow Canadian, who once said, "Medicine is a science of uncertainty and an art of probability." Like my mentor, I believe medicine is both, but my response has evolved over the years. If you asked me at the start of medical training, I would have said that medicine is at least 90% science. At the time, remember, I was steeped in textbooks, anatomy books, medical journals, clinical trial data. But as my clinical career evolved and I cared for more patients and listened to experienced physician mentors, i.e. the older and wiser doctors, and read more non-medical books about patient stories involving their battle with ovarian cancer or their experience caring for someone with Huntington's disease, I quickly learned that there is an art to the practice of medicine. Listening with empathy and without judgment. Communicating using nonverbal cues. Using paintings and piano for stress reduction and other therapeutic benefits. All of this is an art. It's critical to patient care, and you can't learn it overnight. The art of medicine must go hand in hand with the science. I hope you enjoyed today's special episode. You can get involved by seeing your doctor or other medical provider once a year and get 3 things checked: blood pressure, cholesterol, and your hemoglobin A1C. These 3 simple tests can screen, prevent, and or treat the leading causes of death and disability in the United States. You can also talk to your primary care doctor about preventive measures like vaccinations, mammograms, pap smears, and colonoscopies. Learn more from trusted sources like the CDC, Mayo Clinic, and Cleveland Clinic. Well, that's all for today. The show will be on hiatus for a few weeks as I'll be traveling, including speaking in Europe about addiction, COVID, and media. But I'll be back before you know it. In the meantime, here's your joke of the day, medical theme. What did the lung say when it fell in love? "You took my breath away." Be sure to subscribe to my YouTube channel, write comments below, and follow me on Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.